It's now time for Sports Medicine with Malempati.
Hello, everybody, and welcome to another edition of Sports Medicine with Malempati. I'm William Warfield alongside Dr. Malempati. And Dr. Malempati, again, welcome and thanks for taking the time to join us here today.
William, as always, thanks for having me, and always enjoy talking to you and love talking about sports medicine.
Absolutely. And, today is a topic that's a very popular topic. And, it's talking about the shoulder and specifically instability and labral tears.
Yeah, so shoulder instability can be caused by a variety of things, but certainly quite common in sports medicine. So in like your contact sports such as soccer or football, you'll have contact related injuries. Sometimes with the arm out at the side, but those types of injuries where there's force and directed trauma from the front or the back of the shoulder can cause issues with the labrum specifically, which is the cartilage around the socket. And certainly it serves two purposes: deepens the socket, but is important for shoulder stability and keeping that ball within the socket. And when you have a traumatic event that causes a blow to the shoulder, it can cause an injury to that labrum, which leads to instability or feeling like the shoulder is coming out of joint or socket.
Yeah. With spring sports in particular, I'm sure you see a rise this time of year in that, with people playing baseball and softball and other outdoor activities.
Yeah, with throwers specifically, you can have that, but with batters as well. That lead shoulder can take a lot of trauma, causing a directed force on that labral tissue. But with throwers, there's a lot of strain with the throwing motion that can cause injuries to that labrum or lead to increased stress in that area. And with throwers as well, the bicep tendon is attached to the superior aspect of the labrum or the top of the labrum and kind of comes down the front of the shoulder. And they can have injuries in that biceps labral complex or where the biceps tendon is attached. And injuries in that area, in the anchor, can be very painful as well. But certainly any related pain with throwing mechanics or that throwing motion that persists needs to be taken care of and need to seek out a sports medicine opinion and an orthopedic surgery specialist.
Can you explain like shoulder instability and what can cause this in athletes?
So, in two main causes, there can be a acute event or an incident or a traumatic occurrence that directly damages the labrum or the cartilage that we're talking about with a directed force. Also, with repetitive stress over time, you can get wear and tear over that labrum over time and repetitive motions or activities. And those can lead to, chronic instability or instability over time and worsening of the labral tissue.
You mentioned the labrum, Doc. How does that get injured?
Yeah, so again, pretty similar. Can be either an acute directed force that injures that tissue. Sometimes can get squeezed between the ball and the socket. Also, you have the overuse or wear and tear over time that causes degenerative or can cause labral injuries that kind of propagate or worsen over time.
Is there different types of labral injuries?
Yeah, so the most common we see in sports is probably anterior labral injuries, which is in the front of the labrum, and we see that a lot with a directed traumatic force. And those can cause anterior instability where the ball comes out the front of the socket. And if you think about a clock, you're thinking about if 3 o'clock's the front and 9 o'clock's the back, that 3 to 6 o'clock area is important because that can cause significant instability in the shoulder. There's also posterior labral tears, which is posterior in the back. And with that, commonly you'll have offensive and defensive linemen that are engaged with another athlete and have a lot of posterior backwards directed force on their shoulders. And then with the throwers and overhead athletes and baseball pitchers and softball pitchers, volleyball players, tennis, you think about the biceps labral complex that we talked about, where the biceps anchor can be involved over time.
Yeah, and then I got this question coming in too, Doc, is how do you manage these injuries and what does recovery time look like?
So typically, as in most things in sports medicine, there is a role for non-operative management, physical therapy, rehab. If you can strengthen the scapular muscles, there's a X amount of muscles attached to the scapula, and then the rotator cuff. If you can work on those mechanics and strengthening, that can offload pressure off some of the labral issues. Furthermore, you can try injections, anti-inflammatories. Those can be work very well in certain instances to help with pain and relieve inflammation. Injections can be done with or without ultrasound, especially in that bicep tendon area. Ultrasound can help get that injection into the sheath. And then with diagnosis, generally you look at an MRI scan, which will show injuries to that labral tissue or the cartilage of the ball in the socket. And if non-operative management doesn't work, then there's always operative options to fix that labrum.
Dr. Malempati, again, this is great information that we can share with the public on shoulder and instability and labral tears. And we appreciate your time again here today.
Thanks, William. Great talking with you again. Have a great day.
You too. Thanks for all you do down there at Med Center Health, or UK healthcare sports medicine affiliate, Dr. Malempati, for all your shoulder instability and labral tear needs. Make sure to give them a call.